From day one, it was clear this active retirement community needed a hospital.
And today, Saddleback Memorial, a nonprofit, state-of-the-art medical center, provides excellence in healthcare for you and for me.
We welcome you back to our program, and of course our program on Tuesday is brought to us by Saddleback Memorial Foundation and fantastic hospital in our community, the non-for-profit Saddleback Memorial Medical Center. Joining us today, somebody with a rather unique job over there at the hospital. Barbara Grear joins us today, and she's the patient ambassador there at the hospital. And Barbara, welcome to the program.
Thank you.
Good to have you on the show today. We hear a lot of titles and things that we've learned over the years, you know, the hospitalist, a new term for some doctors that work in the hospital, and a variety of things that people have as far as the medical profession. But the topic of patient ambassador is something that's a unique term to me. So tell us a bit about that. What exactly is your role over there?
This is a new role for the hospital, and our vision is to create customer service excellence for every person who comes into the hospital, our patient and families. And it's a part of what we're calling patient family-centered care. Mm-hmm.
So now you work with the staff, you work with the patients. Who do you interface with?
I interface with everyone.
Everyone, okay.
So from the nurses and the doctors to the managers to all the different departments within the hospital, but also most importantly our patients and their families.
You know, when the person's in the hospital, obviously, depending on their condition, they interface with, obviously, the doctors, the nurses, the technicians who might be doing tests on them or whatever. But you're an additional person that comes in and visits them. Now, do you try and see everybody, what, once a week? How often do you visit people?
I can't see everyone because there's too many people. So the way that I come into a patient room is either the patient or family has asked to see someone from administration, or the nurse or one of the people taking care of the patient feel that this patient might need some additional help with their hospital stay. And so I receive referrals. I have a pager.
All right. So someone would have to request you. They'd have to say to the nurse or the doctor or somebody on staff, you know, could I speak to somebody about some of my concerns?
Exactly. And then I would come right away.
And they might be medical, they might be otherwise. They might be some other type of concern as well.
Sometimes people don't feel like they're getting the information, or information isn't coming in a way that's understandable.
Right.
And as a layperson, I can understand the medicalese, but also convey it in a way that would help the patient and family member to understand what's happening and what's going to happen.
Well, if a person's in the hospital, obviously, in most cases, they don't feel their best anyway.
They don't.
Probably the reason they're in the hospital for some maybe medical condition. Right. So they may not be at full level of functionality, plus if they're on some kind of pain medication, sometimes that kind of dulls the senses as well as the pain. So communication might be, you might have to explain something in a different way than you normally would explain it.
Exactly, and sometimes we have to explain things over and over again, just to make sure that the patient understands. What we love is when a family is involved.
Right.
So that can be a reinforcement.
And a lot of times family members will ask questions maybe that the patient won't ask, either won't think about asking or won't feel comfortable asking. The family might ask them. And certainly that's one aspect of your work. But for lots of folks, they're it. Their kids are either back east or they have no family, they're single, and they're here by themselves. And they, I would think, really would rely on someone like you to help them understand, A, the medicalese, and B, kind of be an advocate for them.
Exactly, and I can be an advocate for the patients. We also have a volunteer program, and I know that you've highlighted that in the past. It's called Compassionate Listeners, and those are friendly visitors who come in to spend time, especially with our lonely patients, people who are alone who don't have family.
Right.
And that provides a wonderful ear, someone who's very interested in the patient, and if there are concerns, then the patient, the compassionate listener can page me for that.
They might contact you as well, thinking
exactly.
maybe this person needs some more professional hands-on and a little more talking. You can always use volunteers, I know, in that program. People are looking for something to do. They go, well, I can't be a nurse or a doctor or do those kinds of things, but I can talk to people. You could
people who love people
Yeah.
and want to hear their stories.
Yeah.
That's who we need for compassionate listeners.
Well, as having worked here for a number of years, I can attest to the fact there's many wonderful stories in this community.
Absolutely.
Sometimes people need a little bit of a priming of the pump, so to speak, to get them to speak, but once they open up, fabulous, unbelievable stories from all around the world. So yeah, it's a good way to learn about people. And people feel better maybe if they're sharing some of their own experiences. Maybe takes their mind off of whatever medical condition they're working on too.
Exactly.
Right,
exactly.
That's great. This is a fairly new program?
It is a new program. We piloted it in February through the Patient Advisory Council. They wanted to see something like this happening. So in February we did a pilot project, and we saw our patient satisfaction scores go really high. Sort of like having a mother that overlooks everything.
So you work with the patients, but do you also work with staff members?
I
And if
do.
so, how do you work with them?
A lot of the ways I work with the staff is to mentor excellence in customer service. I speak to staff. If somebody is a little bit off that day, I can be compassionate to them too and help them to do a better job. And maybe they need help with the patient.
Right. I know obviously maybe those of us aren't in the medical field don't understand it, but I'm sure there's stress levels that are unbelievable if you're carrying, because you've got someone's life in your hands in many cases, and so a lot of stress there, I'm sure.
Exactly, and my hat is off to every nurse in our hospital because they really do have everyone's life in their hands.
Yeah, yeah.
And they need to be respected and lifted up and supported.
Would we see you walking around the halls, or would you be in your office waiting for that phone call?
Oh, you'd see me on the halls. In the halls.
And you're there, what, during normal business hours?
Normal business hours, yes.
All right. But you can use some volunteers in this visitor program as well. If people want to get involved, they can contact the hospital.
And I would love it if we had many languages. So if some of our Korean members of this community or Iranian or other languages, we need every language skill, and that helps us in the hospital.
That's a very good idea indeed. If you speak something besides English, probably can use you over there to help, help talk to folks as well. An important job, the patient ambassador. Do other hospitals have this, or is this unique here at Saddleback?
Other hospitals do have this. So it is an emerging trend in California. In some states, it's mandated.
Really?
That's right.
Interesting. Well, they say that eventually all of us are going to need a medical advocate, and we have one there at Saddleback Hospital. And Barbara, we want to thank you for the good work you're doing, and thank you for joining us on the program today.
Thank you so much.
Good to have you with us. Barbara Grear, the patient ambassador over at Saddleback Hospital. And again, you'll see her walking the halls, and just a phone call away if someone's over there and needs to talk to her. She's very much available over there during the hospital hours. We'll be back with more as our program for Tuesday continues here on Channel 6.
The civic-minded citizens and physicians who planned Saddleback Hospital envisioned a full-service, high-tech hospital.
The medical center is a state-of-the-art facility that continually upgrades to remain state-of-the-art.
Our success is a highly skilled, diverse, and caring staff who meets all of your healthcare needs.
We represent virtually all medical specialties, and we practice in close proximity to you, our patients.
Saddleback Memorial Medical Center, keeping the village healthy since 1974.